The Four Leukemias by Lord have mercy!
In this video, we will explore the 4 different leukemias that are fundamentally a type of cancer by highlighting key topics nurses should know. These are acute lymphoblastic leukemia ALL, acute myelogenous leukemia AML, chronic lymphocytic leukemia CLL, chronic myelogenous leukemia CML.
ALL is seen in patients with blastic transformation of B and T cells. It is the most common leukemia in the pediatric population, accounting for up to 80% of cases in this group versus 20% of cases in adults. AML is characterized by greater than 20% myeloid blasts and is the most common acute leukemia in adults. It is the most aggressive cancer with a variable prognosis depending upon the molecular subtypes. CLL occurs from the proliferation of monoclonal lymphoid cells. Most cases occur in people between the ages of 60 and 70. CLL is considered an indolent disease for the most part, meaning not all patients with a diagnosis will need to start treatment until symptomatic from the disease. CML typically arises from reciprocal translocation and fusion of BCR on chromosome 22 and ABL1 on chromosome 9, resulting in a dysregulation on chromosome 22. This in turn causes a monoclonal population of dysfunctional granulocytes, predominantly neutrophils, basophils, and eosinophils.
Cells have a life cycle. Just like all other living things, they develop, grow, and eventually die. In leukemia, there's a disruption in that life cycle. Either the adult cells never die or the baby cells never grow. Leukemias are classified based on when the cells deviate from their life cycle, known as acute and chronic. After the cells have reached maturity, a malfunction in the life cycle leads to chronic leukemia. Even though the adult cells can frequently still operate to some degree, they are eventually incompatible with life. When a cell's life cycle is interrupted early on, the result is acute leukemia. These newborn cells that are stumped then serve no purpose. Symptoms of leukemias differ between the two. Chronic leukemias develop slowly, so most people don't experience as many symptoms. However, patients with acute leukemias typically bleed easily, like when brushing their teeth, and they may also have frequent nosebleeds or heavier menstruation. They often also experience fever and fatigue.
ALL is caused by DNA mutation in stem cells, which causes an overload in white blood cell production. As immature cells increase in number, the healthy red blood cells and platelets fall, and this causes the production of symptoms. During the mutation, the bone marrow cells are told to continue growing and dividing. As a result, the blood cell production becomes out of control. The bone marrow produces immature cells. The abnormal cells aren't able to function properly, which forces healthy cells out. CLL occurs when there's a change in the genetic material in the bone marrow. The bone marrow makes abnormal lymphocytes, and when the cells crowd out, the healthy cells can lead to an infection. The abnormal cells can spread outside the blood to other parts of the body. CLL is a disease caused by damage to genes of growing lymphocytes in the bone marrow, causing cancerous B lymphocytes. This injury disrupts the normal lifespan of lymphocytes and crowds out healthy blood cells, potentially affecting the ability to perform normal functions.
AML occurs when a bone marrow cell develops mutations in its DNA. The mutation occurs in a gene involved in the formation of blood cells that causes a buildup of immature myeloid cells, or blasts. The mutation of the cells fails to allow them to differentiate, leading to an out-of-control growth of abnormal myeloid cells. The failure of the cells to differentiate disrupts the normal function of the blood. CML is caused when chromosomes in the blood cells swap sections. A portion of chromosome 9 swaps with a portion of chromosome 22. The result is an extra long chromosome 9 and an extra short chromosome 22. The new chromosome 22 tells blood cells to produce too much of the tyrosine kinase protein. The protein allows too many white blood cells to grow. These white blood cells are faulty and don't develop and die properly. Instead, they clump together into large numbers, harming healthy cells and damaging bone marrow.
ALL is often diagnosed in children, especially those under 5. While adults, including both genders, can develop it, males face a slightly higher risk. About 80 to 90% of ALL patients achieve complete remission, but around half may experience a relapse. 40 to 50% not only reach complete remission, but also avoid relapse, showcasing a variety of treatment responses and outcomes. AML, men have a higher likelihood of developing it compared to women. Previous chemo and radiation raise AML risk. Radiation exposure is also a factor. Over 25% of adults with AML, about 45% in complete remission, may survive 3 or more years and possibly be cured. CLL is most common in older adults and is rare in young adults and hardly ever develops in children. About 90% of people diagnosed with CLL are older than 50, Around 85% will survive CLL for 5 years or more after being diagnosed with it. It's most common in older individuals with a slightly higher risk than men. Those diagnosed have a 90% chance of surviving 5 or more years.
Some common general treatment for leukemia is chemotherapy, which is used for acute lymphoblastic leukemia and acute myeloid leukemia, radiation, immunotherapy,
targeted therapy, which uses drugs to target specific parts of the leukemia cells. It is the main treatment for chronic lymphocytic leukemia and chronic myeloid leukemia. Hematopoietic cell transplant, chimeric antigen receptor, or CAR T therapy. The treatment for acute myeloid leukemia is divided into 3 parts: induction, which is a period of intense chemotherapy, consolidation, and maintenance, which uses lower strength chemotherapy.
Finally, symptoms all nurses should know: dizziness, fatigue, shortness of breath, pale skin, frequent infections, swollen lymph nodes, anemia, bruising easily, enlarged spleen or liver.
Just
Or what am I writing? Just that?
yeah, not much.
Okay.
Just that.
Make sure it fits what you're doing.
All of it in one go.
Yeah?
Okay.
Why?
I'm hurting, but it's okay.
Oh.
The Four Leukemias by Lord